Welcome to final presentation night. Thank you for choosing my presentation to attend. I can't wait to share with you everything that I've learned throughout ISM this year. I would like to give a special thank you to my mentor, Dr. Victor Aquino, for letting me shadow him in the clinic and having one-on-one meetings to teach me about pediatric hematology and oncology. I hope you enjoy my presentation. Let's get started. Imagine taking your son or daughter to the doctor, assuming that they have a stomach bug. After a few tests and scans, you find out that they have cancer. This is exactly what happened to Victoria and her family. She ended up having a Wilms tumor. This happens so very often because the symptoms of cancer are very similar to those of common illnesses like the flu. I chose to take ISM because I wanted to be able to make sure that pediatric hematology and oncology was something that I actually wanted to do. It's a very emotional job, and I wanted to make sure that I could handle it and that I wouldn't be really emotionally attached to everyone I saw and just be a mess when I was at work. And so far I think it's good for me. It's not like I've seen anyone die or anything, so I don't know or have a super personal connection to someone, but as what I've done right now, this looks really good for me, and I'm really excited to keep learning about pediatric hematology and oncology. I also took ISM because it would allow me to experience the medical field in a kind of a hands-on way. I would be in the hospital following him and seeing exactly what he does on a day-to-day, and that's not something that you get to do really until you're fellow, and that's a long time away for me, so it would be kind of a waste if I went to college and got to my fellow and realized this was horrible and I can't do it. And I also took it to make the connections to the real-world professionals and learn how to interact with them, because before ISM, I didn't really know how to interact with a professional, how to interview them, what to wear really. I've learned so much about professional clothing and emails, how to email them, how to talk to them on the phone, how to find them, because you have to call and you don't get them directly, so you have to keep going line to line to finally reach them. So those are all great things that I'll be able to take throughout the rest of my life that I've learned in ISM this year. At the beginning of the year, we were suggested to take a quote and relate it to what we thought our ISM journey was going to be like. And I picked one by Henry Ford, and it's, "When everything seems to be going against you, remember an airplane takes off against the wind, not with it." And I chose this quote because I think it relates to my ISM journey, because finding a pediatric hematologist and oncologist wasn't going to be easy, and learning about pediatric hematology and oncology wouldn't be easy either. But all the work that I've done so far is definitely worth it to see myself achieve the goals that I set at the beginning of the year. And that's just how, when an airplane takes off against the wind, it still gets to its destination, which is usually a vacation or something good. I think it can also relate to kids with cancer, because it's a very hard battle for them to fight, and they might not necessarily survive, but maybe the hope of surviving is enough to get them through, and it's something great. So our first major assignment in ISM was to conduct 5 informational interviews, and I conducted 6, and they were all from UT Southwestern or Children's Health. They were all great informational interviews, and I learned so much more than I ever thought I would from just talking to someone, and I think I learned more than I ever could from online searching up about this topic. So my first interview was with Dr. Victor Aquino, and he specializes in bone marrow transplants, and he taught me that there's a high survival rate in childhood cancer. It's greater than adult cancer, and it's a 70% to a 30% ratio, so 70% of them will survive and only 30 will die. He studied immunology before he went into pediatric hematology and oncology, and he also studied sickle cell. And immunology plays into pediatric hematology and oncology because the chemo compromises their immune system and they can easily get sick, and he knows how to deal with that since he did immunology before. And he also still treats patients with no immune system, when they're born with no immune system. He knows how to fix that by giving them a transplant and have the donor cells grafted to theirs, and they will get an immune system. After I interviewed Dr. Aquino, I interviewed Dr. Martha Stegner, and she was really busy the night that I went to interview her, but it was totally worth the wait because she allowed me to look at some slides of a blood sample. It was from like a new patient, and they thought they had like leukemia, and so she got to show me like what she was looking for in the cells, and I actually got to look in the microscope and see what it looked like. So that was really cool, and it was a one-of-a-kind experience. And she told me not to stress about everything and to enjoy the time that you get with the patients. And I think that is really something that's going to stick with me through the rest of my journey, because I think if this is something that I go into, it's something that I'm going to have to remember that it's going to be hard, and I'm going to want to just always focus on the patients and just try to get everything done. But sometimes I might need to take a step back and just enjoy what I'm doing and remember why I started doing it and relate to the patients and just talk to them. And she also said that she preferred kids with a serious illness, which I think really spoke to me, because I think that I would like to treat a kid with a serious illness, because one, you would get to see how much of an impact you had on their life, because they would come in so ill, and when they would leave you, they would be almost healthy and back to normal, and that would just be really rewarding for you to see. And also you would get to spend more time with them and be able to connect to them on a personal level, but still keep the business relationship. And it would just be such a big impact, and that's what really spoke to me about her saying that. After interviewing Dr. Stegner, I interviewed Dr. Andrew Coe, and I really enjoyed interviewing him because the first two doctors that I interviewed, they were a only clinic, and he did lab, and that was a side of pediatric hematology and oncology that I had never thought of before. When I really thought about the subject, or when I thought about the field, I thought in the clinic with the patients, treating them, not the stuff behind the scenes, the lab work they have to do to get the vaccinations and the chemotherapy and figuring out the new drugs. And so that was really cool. I also got to see, like, our interview was in his lab, and he showed me where like they keep all their stuff and all their different like tools. They had like this really cold freezer looking thing, and like walked into it and it kind of smelled funny, and it had like all their different trials and things they were trying to do with like their rats and plasma and all that kind of stuff. So that was really cool. And one of the things he told me was that the reason that kids have a higher survival rate is because they're more resilient to the chemotherapy, and that's because their organs have less wear and tear on them. Their epithelial layer is still healthy, and it's like they haven't been smoking and drinking or doing anything really to tear it down, especially those who are really young and under 5. Their organs are fresh and they're ready to fight, and so that helps them survive. Also, he said to ask what motivates you, and that spoke to me too, because after visiting him, I thought that lab would be kind of cool, and maybe I would want to do that because you get to learn so much from that, and you actually get to see like the trials like go into place and stuff. And so he said, ask yourself if you have an intellectual desire or if you have an emotional desire. And after that interview, I was really contemplating whether I did have an intellectual desire or an emotional desire. And I just thought about it a lot, and even though I do want to learn a lot and really just grow in my knowledge, I think that emotional is more of what speaks to me, because when I think of pediatric hematology and oncology, I think of being with the patients and seeing them and just seeing them get better and having that personal impact on their life. And you wouldn't really get that in lab. And through my mentorship, I have learned that you still do grow intellectually in the clinic because you have to keep up with the times. So you still learn a lot and you just keep growing. So it's not as much like an intellectual growth as you would in the lab, but it's still enough to, I think, that would keep me happy. He also said that you need to be focused and stubborn. And he said you need to be focused because you need to keep your eye on the goal of getting your patients cured and getting everything done and not getting too distracted. But you also need to be stubborn, because if something, like you thought this certain drug was going to work on this patient, you would need to push for it, because if it actually does work, then that's good. And if you would have just let someone walk over you and say, okay, fine, we won't use it, you would have never known that it would have worked. And so that's really important for me to remember, that you need to stick to your grounds if you think something's going to work. After Dr. Coe, I interviewed Dr. Patrick Levy, and he talked about the frustration of not being able to cure patients. He said he didn't understand why, when he would treat 2 leukemia patients, that he would use one set of drugs on one and one set on the other, but it wouldn't work, and they had the same type of leukemia going on, and he couldn't wrap his brain around why it wouldn't work that way. And that kind of made sense to me, because you think that, you know, if you have leukemia, you should be able to use this and it'll help get rid of it, just like if you have flu, you take Tamiflu and it helps get rid of it, but that's not the way it is. He also said that when he's in the clinic and he's talking to the patients, when he walks in the door, he forgets about everything else and only focuses on his patients and how they're doing, and tries to really just understand what they've been going through and explain to them that he'll be able to help them, and he tries to immerse himself in their life. And I think that's really important, because you do need to have a connection with them, or they're not going to trust you and understand that you'll help them get better, because they get poked and sticked all the time, and they go through different surgeries, and it's not fun when you're young, and it hurts, and you need to show them that you're there for them and you'll help them. He also told me that the ways you treat cancer is through radiation, chemotherapy, or surgery, and it's just obviously different depending on the cancer that you have. And he also talked about how clinical trials for kids help the doctors, because in clinical trials you take groups of kids with similar cancers and characteristics, and you try different drugs on them or a different therapy, and they can see if it works on these kids, and then they can also see if it works on another set, and it helps them grow and advance in the medical world about what drugs work and which ones don't. And that's also another reason that kids can survive the cancer, because they're constantly enrolling them in clinical trials and trying to improve their treatments. After Dr. Levy, I interviewed Dr. James Amatruda, and he did something that Dr. Coe said was really hard. Was he does lab and clinic, and it takes a lot of time to do that and a lot of devotion. So he does 80% lab and 20% clinic, which is pretty cool because he gets to see both the sides. And a benefit to being in both was that he had 2 sets of colleagues, one's in the lab and one in the clinic. And so if he saw problems that weren't being solved by the people in the lab or vice versa in the clinic, then he could take them to the opposite specialty. So he would take his clinic problems to lab and lab to clinic. So you would get a new set of minds to work on this problem and try to get it solved. He also talked about how the child's life is out of your control. So once they go home, there's not much you can do. They're under your care in the hospital, and they're still under your care out there, but you can't go to their house and help them and make sure they take their medicines and that kind of stuff. You can't do that. You can only do that when you're in the hospital. He also said that targeted therapy is really hard to do, but it's really beneficial because it targets the cancer directly rather than going through your whole bloodstream and killing all your good cells and your bad cells. And he said a really new thing that they've come out with is DNA diagnosis, and it's more exact about everything, and so it can help them determine the cancer and better ways to treat it. After Dr. Amatruda, I had my last interview with Dr. Andrew Martin, and he was brand new to the practice, and so he just taught me about the basics, but there were things that the other doctors didn't really mention. So he said that you have to be recertified every 7 years in pediatrics, so you take a test every 7 years just to make sure that you still know what you're doing and those kinds of things. But when you go into a specialty, so if I were to go into pediatric hematology and oncology, that would be my specialty, and I would have to show growth in my knowledge and that I'm staying with the time and not continuing doing practices that were done 10 years ago, because there's so many new things since then that you shouldn't be doing that. You should be keeping up with the new medical advances, and so they have to do like research projects to show they know what they're still doing and that they're keeping up with the time. He talked about how you're never really off work, that the hours are 8 to 5, but usually you bring your work home and you try to figure out if you got stuck on something that day, you took it home and tried to figure it out so that when you came back tomorrow, you knew what you were doing and you could just get it done. He also talked about how the chemo brought a low blood count and a compromised immune system, which allowed for more infections, and they have trouble fighting them off since they don't have an immune system. And it would be like if they got the flu, they would have a really hard time to fight it off, and it could be some common illnesses can be fatal to them since their immune system is so weak. And he also talked about how clinic is translational, so they take things from lab and use them in the clinic. From all my interviews, I learned that kids are more resilient to the chemo than adults are, which was really surprising to me because I thought they would be weaker than adults would, but they're not. Also that chemo brings other problems since it's administered through the bloodstream, so it goes everywhere, not just the one spot. Like you might just have cancer in your kidney, but it hits everywhere, and that's really what makes them sick. Also, chemo kills the DNA, which kills the cells, the good ones and the bad ones. And treating a patient is a long process, and you need to have patience. You need to be dedicated to your work and the patients and have passion and ambition to do better than you did the day before. And never stop working, even if you're stuck or you're just frustrated, just keep going. And that's just a breakdown of all the different types of pediatric cancer, the most common ones. After all those interviews, I chose Dr. Victor Aquino to be my mentor. And I'm really glad I chose him. He's really awesome, and he's taught me so many things this year, more than I could have ever imagined. And he works for UT Southwestern and Children's Health in Dallas, so we always have our meetings at Children's Health. Occasionally, we have them at Children's Health in Plano, but it's really rare because their clinic there is small. And I think my first day was probably like the best day ever because it was just like, wow, I got to see so many new things that I'd never seen before, and I'm pretty sure it was like a day off from school, so I stayed for like 4 hours, and I thought it was just the coolest thing I'd ever done in my entire life. And I got to see a spinal tap, and the anesthesiologist was like, make sure like you sit up against the wall and try not to pass out. If you feel lightheaded, like start breathing like deep in and out and lean up against the wall or close your eyes. Try not to think about it. He's like, in the past month we've had like 6 people pass out, and I'm like freaking out now that I'm in there, and I'm like, oh my god, I'm gonna pass out. But I didn't, and I was so excited that I didn't pass out. I just thought that was the biggest accomplishment ever. And so that was just so exciting when I got to see that. And so like I've already said, that he's a pediatric hematologist and oncologist who also specializes in transplants and immunology. And his work, his like specialty inside a specialty, plays into what my final product will be in the end. Throughout the beginning of the year, so the first semester, we did our own research that was like off the internet or like articles we read. Like mine had to be peer-reviewed and like scholarly articles since it was talking about the medical field, so you had to make sure they were accurate and reliable. And that was kind of frustrating at first because I didn't really understand what it was, and I didn't know which ones were good and which ones I shouldn't use. But these are good articles that I got my information from. And so the first thing I did was I kind of just dove right in because I wasn't sure what I wanted to research inside the field of pediatric hematology and oncology because it was such a new subject to me. So I started out with understanding a patient because that's pretty important when you're being a doctor. You got to know how they feel and stuff like that. So I was like, that's a great start. So I decided that I would research that. So I learned that people need to be educated on cancer, that they don't really know about that many cancers. I didn't know about that many cancers. Like, you know, you don't really hear about them on the news. You really just hear about like breast cancer or like bone cancers and stuff like that. Those are the most common cancers you hear about, and there's so many other cancers there too that you don't hear about. Like, I never hear about a Wilms tumor on the news or something like that. And so I got to learn, people need to be educated on that, or they're not gonna know when, like, if they did get that cancer, they wouldn't know anything about it. So then I learned about how cancer is emotionally and physically draining. Before I researched that part, I kind of knew that it would be physically draining because they're getting all this medicine and it's really hard to tolerate, but I never really thought about how it would emotionally take a toll on their life. And some of them can become depressed or have anxiety about going to the doctor and stuff, and it can make them really hard to just do the things that they normally did before. In the patient's eyes, it's really hard for them to think that people understand what they're going through, because it's just something that is really hard to, it really is hard to relate to, because unless you've had cancer, you don't really know what it's like to have to go sit in a room and be pumped with chemotherapy for four plus hours. You don't know what that's like. You don't know what it's like to be bedridden, just laying in a hospital, like can't keep anything down. You don't know what it's like. But as a doctor, you'll have to be able to explain to them that even though you haven't had cancer, you treat these patients every day, and you do understand from a doctor's perspective what they are going through, and you can help them get better if they listen to you. And but you have to understand it from their side too, that they're just out there. After that, I researched delayed effects of childhood cancer, which plays a big role in my final product, which I'll talk about later. Late effects, it comes from the chemotherapy and the drugs, not necessarily just the cancer, but it can come from the cancer too. Since chemotherapy isn't localized, it attacks all your cells, good and bad, and that's what makes them also makes them sick. That's how they get nauseous, they lose their hair, and those kind of things, because not only is it killing the bad cells, but the good cells are the ones that are reproducing and trying to keep you healthy. They have physical and emotional effects after they're cured of cancer or have survived 5+ years. They still will have effects, depending on, especially like if you have a bone cancer, you could have had to amputate your leg, or because the cancer was so bad, or you could become blind from a cancer, especially if it's in your brain. You have a brain tumor, you can become blind. And the emotional effects are, they're depressed a lot. They're very depressed afterwards, and they have a low quality of life during and after, and it's hard for them to get back on their feet and try to do the things that they normally did, especially because they're very weak and their bodies, they feel like they've been hit by a bus. Their body has been really worked by these drugs. And something that I found out in this article that I would have never thought of before was that when you relapse, you don't have to get the cancer that you had before. I always thought, like, if you had leukemia and you relapsed, you would get leukemia again, but you don't. In this article, it talked about how if you had Hodgkin's lymphoma, it was likely that if you relapsed, you would get leukemia. And also, I experienced that in clinic. One of my mentor's patients had a bone cancer, and like maybe a year or two later, he now has leukemia. So it's really sad that he relapsed, but it was just like proving that what they said was true. After I researched that, I researched common childhood cancers, and this plays into my original work. The biggest thing that I got out of this was that the symptoms of cancer resemble common illnesses like the flu, and you would think that they would have like just the most outrageous symptoms of like, oh my gosh, you can't even see out of your eyes anymore because you have a brain tumor, but you might only be nauseous. And so that's like, you wouldn't think, oh, I'm nauseous, I have a brain tumor. That just doesn't connect in most people's minds. Also, I learned about how protocols at the doctor are different for each cancer they diagnose. So if they think you have a blood cancer, they're obviously going to draw your blood and check your white blood count and your red blood count and just see how it is, low or high. And then if you had like a tumor anywhere, they're going to take a biopsy to make sure it's cancerous and not just benign. And then it also talked about how the treatments vary between each cancer. So if you had a blood cancer, they're going to give you most likely chemo, and they could possibly give you radiation. But if you had a tumor, you're definitely gonna surgery is the best decision to remove it, but it's not always possible. So sometimes they'll have to use radiation and chemotherapy to make the tumor smaller, so it is surgically removable. The last thing that I researched in the first semester was just helping out those with cancer. And I kind of thought that was important to know, so when you're diagnosing a patient, you can kind of tell them it's not gonna be easy and all that stuff, and you need to notify your family members so they can come and they can help you. And it talked about how you should help with their meals, because sometimes, or most of the time, they might have to eat fast food, and it's hard for them to always be making a home cooked meal. And so if you make them a meal, they can just heat it up and it's like it's home cooked. And also, if they have other children, offer to help with them, take them to school and their extracurriculars, because the parents might be busy taking the child with cancer to the doctor, and it would be hard for them to get their children to school and to other activities. So after we did all the research, we did our original work, and I did mine without my mentor because I started it without him, so I wanted to finish it without him, because I started it before I got him. And so my original work is a chart of about all the common pediatric cancers, and I wanted to do this because this is a very new topic to me, and I really didn't know that much about it, and I wanted to basically educate myself and also educate others from reading articles. People don't necessarily know that much about all the small cancers, and I wanted this to be like a chart that they could read and understand it just from reading that chart. It would be on a 6th grade level so that everyone can read it. And in the medical field, I've actually learned that you have to write down from what you're educated as. So you're obviously educated with scientific lingo and medical lingo, but you have to write at a 6th grade level, because some of the people that come to your office, they might not even be educated to a 5th grade level, and so it'll be easy for them to understand what you wrote. So my chart is, it should be easy to understand. I think it's easy to understand, and I didn't really know much about the topics, so I think it's good. And I think it will help people with new diagnoses too, because of the things that I have on my chart. I have support groups and resources, so ways they can reach out to talk to other people that are diagnosed with the same cancer if they just want someone to be able to relate to them. So for the process of my original work, I researched through different websites that my mentor had actually suggested for my final product, and I was able to find out information about each of the cancers. So I found out the description of them, just for how you would look at it as, and the symptoms. To complete it, I had to find accurate and reliable information. I had to make sure that they were scholarly reviewed articles, peer reviewed, so that I knew what I was putting in my chart was accurate and it would be right. So the columns in my chart, I had 7, and it was description, so it's just the generic description of the cancer. I had symptoms, so what to look for if you thought your child might have this cancer. I had statistics, which is the 5-year survival rate, and I had the treatments from the most common to the least common treatment that you would see. I also put clinical trials that you could enroll in, could look in to enroll in, and ones that were already done, so you could see how they benefited the other children to decide if you really did want to put your child through that. I also had the resources and support groups for them to reach out to learn more about their cancer. So these are pictures of my chart, and the gray boxes state the cancer, and then the green headings are what I just described to you, the description, the symptoms, etc., and then all the writing filled in. So since I did about 18 cancers, I'm not going to tell you about 18. I'm only going to tell you about the most common out of the common. And so the first one is the most common childhood cancer is acute lymphoblastic leukemia. So ALL is the most common childhood cancer, and it's found between the ages of 2 and 4, but not limited to. Other people can get it as well. It begins in your bone marrow, and it can spread quickly through your blood into your organs, and once it spreads to your organs, that makes it a stage 4 cancer, and that's a really tough cancer to beat. The symptoms to look for are bone and joint pain, fatigue,